Our next presenter is none other than Dr. Francis Were. We always enjoy his presentations. Dr. Were is a gynecologist with over 15 years of experience. He's currently a lecturer at Kenyatta University, and his kiosk is in Nairobi. You can always reach him on his phone. He will be presenting on CLITOROPLASty. Nanipigiwa makofi.
Okay, ladies and gentlemen, the hour has come. Okay, so I'm going to present on CLITOROPLASty, aesthetics and functional restoration. I have one particular case report that I want to focus on, so that we see the importance of this procedure. As a background information, female genital mutilation, or FGM, has a prevalence of about 15% and is a harmful practice and has significant psychosexual and physical and reproductive health consequences for those who survive. FGM complications such as sexual dysfunction, chronic pain, cysts and neuromas, and also complications of during childbirth are experienced a lot by these clients. So the psychological impact for survivors usually manifests as a low self-esteem, anxiety, depression, and difficulties in sexual relationships due to impaired genital function. That we are going to elaborate on as we go along. And one of the common effects of FGM is the loss of sexual sensation with the inability to achieve sexual satisfaction and orgasm due to partial or complete removal of the clitoris. And CLITOROPLASty, which is the procedure, restores the aesthetics and the functionality of the clitoris in women who have undergone FGM. It helps to restore the nerve function and sensitivity of the clitoris, and therefore improving the sexual well-being of the patient. So that image you're seeing there is all well known to us, but just as a reminder that the clitoris is the primary center for sexual pleasure in female anatomy, and it's made up of a complex network of tissues and nerves, and is visible at the top of the vulva. Now the complex, the union function of the clitoris, the labia, and the urethral complex tend to work in sync during sex to ultimately achieve an orgasm. I'm sure, okay. By reconstructing genital anatomy, the surgery helps to mitigate the risks during childbirth, improving both reproductive health outcomes and overall quality of life for the survivors. So aesthetic reconstruction of the clitoris is not enough, since it's with little or no sensation after it has happened. And you're going to see that with the case report that I'm going to present. So usually there is a rehabilitation of the clitoris using biologics, which I'll elaborate, and clitoral physio, again I'll also elaborate on that, to restore it to a fully functional state with the ability to achieve an orgasm. And this takes usually about 6 to 12 months of rehabilitation. So we present a healing journey of a patient who had FGM in childhood and never enjoyed a sex life in adulthood, and even in marriage, until the restorative surgery was done and subsequent rehabilitation. So we have a 34-year-old para-2 lady who came with a history of anorgasmia, unable to achieve orgasm, low self-esteem as a result of FGM in childhood. She narrated a dull sex life and was eager to be like her friends who enjoyed their sexual relationships. When I examined her, the external genitalia she had FGM type 1, which means the clitoris was partially amputated, and we could actually feel the clitoral stump beneath the scar. The labia and the perineum were largely intact. So then I went ahead and counseled this patient and explained to her what clitoroplasty was all about and the aftercare that was to follow. So surgery was then planned. She signed consent for both medical photography. Medical photography are those images we take before the procedure, during the procedure, and after the procedure. Purposely, we use them for following up the patient and also for learning as we go along. So I then reviewed her and discharged her from hospital for about 48 hours and subsequently had several follow-ups for the past 1 year as the clitoral physio continued. She is now fully healed as the clitoris re-epithelializes slowly, and now she's able to orgasm powerfully like never before. Okay, so let's continue. So that image just shows the what she had initially. You can see the stump there. This is where the clitoral stump is buried, and you can see the labia appear largely intact. Now, intra-op, the clitoral stump is dissected as shown on the diagram there, and then it's gradually pulled below, and then of course we free the crura. The crura are the arms of the clitoris that are usually on the sides. That is just another image showing the surgery in progress. And then after the surgery, of course, the first image on your left shows the healing process of the newly rehabilitated clitoris. And then 3 months later, you can see the clear transformation. And there you are, the before image showing the scar where the clitoris is buried, and the after image. This was the latest image that we took. As you can see, a beautiful clitoris trying to reepithelialize pole takes a while, but there she is, very happy with the result. So for discussion, FGM is an age-old practice among some communities in our society with the sole aim of taming sexual desires in girls before marriage. The result of this practice causes immense suffering and complications among the survivors. Some of the complications of this practice include psychosexual problems, sexual dysfunction, complications at childbirth, severe pain and shock, and of course sometimes even broken limbs when they are being pinned down during the cut. Some even get infections, cysts and neuromas and so forth. So restoration of the vulva, aesthetics and sexual function with the sensation in the clitoris is the hallmark of clitoroplasty. Because I've seen many patients who have had clitoroplasty done, but the clitoris is non-functional. So it's very frustrating for them. So during clitoroplasty, the disfiguring scars in the vulval area are also looked into. Then follows a long journey of rehabilitating the clitoris with biologics and clitoral physio. So biologics are basically the use of platelet-rich plasma. And this helps in regeneration of nerves and the eventual restoration of the clitorolabiourethral function. Studies done by Iglesia et al. And Frischen demonstrated functional restoration, including ability to experience orgasm, was achieved in majority of women who had reconstructive surgery done following FGM. Another key aspect of reconstruction is restoration of self-esteem. In our patient, this patient now actually had her self-esteem restored, And she's currently a very, very confident woman in whatever she does. So in conclusion, clitoroplasty remains a vital surgical intervention for restoration of both functional and aesthetics of the clitoris in women who have had FGM. The outcomes of this case highlights the importance of clitoroplasty in improving sexual function, aesthetic appearance, and psychological well-being of these patients. While challenges remain, the positive results achieved in this case underscores the value of clitoroplasty as a tool of enhancing quality of life for those FGM survivors. Call to action. I would want Kigondo to tell us which bird this one is. Huh? Have you ever seen that bird? It's a flightless bird. That is the clitoris. Let us strive to save this bird from decapitation. Thank you.
I think I'll let you go to
Yeah. Yeah, the COG Central Symposium is never complete without Were. One of the reasons why Were was invited was he gave Dr. Joy Mugambi shock therapy in the last symposium, and she revealed that people in Meru, they actually need some, what he's talking about. Meru, they do 96% FGM1. My first question is what biologics are these that you're talking about?
Okay.
Let me get 5 questions.
Okay.
Thank you. Thank you, Dr. Wayne. Thank you. I'm just wondering whether all the women who have had FGM don't achieve orgasm. And
can I answer directly or?
Just
Okay.
Yeah. So when you think about that, then you also want to think about the other things which make people enjoy coitus. It's something to do with the psychology, and you may have FGM, but still enjoy. So I don't know whether all the women who have had FGM don't. The other thing which I want to ask about is this added surgery. FGM is a surgical procedure, and we know that healing the scars and so on creates the complications that usually arise. Now with this elaborate literature, whatever,
that one,
yes, being done, and we increasing even more scars around that area. And have you checked whether, apart from enjoying sex, they also have further complications from the scar that you have given me? Thank you.
Dr. Were, seems like you reconstructed the glands, but did not construct the hood. We know that the hood is protective of the glands. How do you prevent, what advice do you give the women to prevent those abrasions that may affect the glands? Because whatever I've seen on that image is just the glands alone. And I know it is subject to injury. I would like further elaboration. Is it possible to construct a hood also? Maybe by plastic surgery or something like
Okay, so can I go ahead and answer those two? Now, the first question from my good old friend, FGM and orgasm. Do those women who have undergone FGM still orgasm? Majority of them don't. And you see, orgasm is the ultimate icing on the cake of sex for all human beings. So we do that because they want to enjoy their sexual lives, okay? But particularly for those who have undergone, the severe form of FGM, orgasm is quite a challenge. I mentioned that the clitoris, the labia, and the urethral area, the suburethral area, or the so-called G-spot or the Grafenberg spot, is what is involved in achieving the ultimate sexual pleasure. So when we're actually doing clitoroplasty, we not only do surgery on the clitoris to actually unearth it from where it's buried underneath the scars, but we expose it, and then upon exposure, then we try and rehabilitate it so that at least it can become sensitive to touch, and therefore they're able to enjoy their sex. Now, clitoroplasty does not cause more scarring because there's already a scar there where the clitoral stump is. So what we simply do is to cut over the scar and expose the clitoris from below. So we don't cause any more further scarring. But of course, people have different healing powers in their bodies. There are those who easily form keloids, even with little small scars. So you may find that you do this procedure and the patient may come back to you with a keloid as a result. But then again, that is now then passed on to our other colleagues who know well how to manage keloids. Now, for my friend Nyongesa, the clitoral wood, the function of the clitoral wood, yes, it's protective somehow. But we know very well that in sexual medicine, there are places where ladies go for clitoral wood removal. It's more like a circumcision to them, that when it is exposed, when the clitoris is exposed, then they tend to enjoy more sexual pleasure than when they have it. For clitoroplasty, the wood was long gone when they had the FGM done, so it is not there. And again, reconstructing it would be a tall order. We would need to engage our plastic surgeon colleagues to create a flap. But what we have there is a little the glans clitoridis is a very small thing, and creating a wood for it would be quite a challenge. If you go to Egypt, Egypt is the center of this kind of practice. They do it a lot, and women there testify that they go for clitoral and wooding just to increase their sexual excitement. There's none. Huh?